Hey clinical detectives and chronic illness champions, what if shortness of breath, edema, fatigue, and neuropathy all pointed to one rare hidden culprit? Today we're unpacking amyloidosis, a group of diseases caused by abnormal protein deposits that infiltrate and damage the body's most vital organs. It's complex, but with the right knowledge, nurses can spot the signs, support care, and guide patients through this challenging diagnosis. Amyloidosis refers to a group of rare but serious diseases where misfolded proteins called amyloid build up in tissues and organs, impairing their function. The misfolded proteins resist breakdown and form insoluble fibrils, disrupting normal tissue structure and leading to progressive damage. So let's talk about the types of amyloidosis and which organs they tend to affect. AL, or primary amyloidosis, is the most common and is caused by abnormal plasma cells producing light chains. This type often affects the heart, kidneys, nerves, and liver. Then there's AA, or secondary amyloidosis, which occurs with chronic inflammatory conditions like rheumatoid arthritis or inflammatory bowel disease. This one usually impacts the kidneys, liver, and gastrointestinal tract. Hereditary types, such as ATTR or AF, are due to genetic mutations and often involve the nerves and heart. Dialysis-related amyloidosis is another form, where beta-2 microglobulin builds up in joints and tendons. Now, symptoms really depend on which organ is involved. For the heart, you might see restrictive cardiomyopathy or arrhythmias. If the kidneys are affected, you could notice proteinuria or nephrotic syndrome. Nerve involvement can cause peripheral neuropathy or carpal tunnel syndrome. In the GI tract, symptoms like malabsorption, diarrhea, or weight loss may appear. And for the liver, you might see hepatomegaly or elevated enzymes. When it comes to diagnosis and workup, there are a few key steps to keep in mind. A biopsy is used to confirm amyloid deposits, often taken from abdominal fat, rectal tissue, or the involved organ. Congo red stain is used, showing apple-green birefringence under polarized light. Serum and urine electrophoresis, SPEP or UPEP, help detect monoclonal light chains, which is important for AL amyloidosis. Genetic testing is performed for the hereditary types, and you might use cardiac MRI, echocardiography, or SAP scans to assess organ function. So, let's talk about treatment approaches. The plan really depends on the specific type of amyloidosis. For AL amyloidosis, treatment might include chemotherapy or an autologous stem cell transplant. The CyBORD regimen, bortezomib, cyclophosphamide, and dexamethasone, is commonly used. For AA amyloidosis, the focus is on controlling the underlying chronic inflammatory disease. Now, when it comes to hereditary amyloidosis, or ATER, medications like tafamidis or patisiran can help stabilize or silence the transthyretin protein. In some cases, a liver transplant might be considered. And of course, supportive care is absolutely critical. Managing heart failure, renal dysfunction, and neuropathic pain is key. Let's move on to nursing care and patient education. For organ-specific monitoring, it's important to track daily weights and watch for edema if the heart or kidneys are involved. Blood pressure and orthostatic vital signs should be checked regularly. And don't forget about peripheral neuroassessments to monitor for sensory loss. Managing complex treatments means keeping an eye out for chemo-related side effects, supporting patients through stem cell transplants, and coordinating care with cardiology, nephrology, and hematology teams. When it comes to patient and family education, it's essential to explain the progressive nature of amyloidosis and set realistic expectations. Make sure to stress the importance of follow-up and symptom tracking, and always provide emotional support. Connecting patients with support groups can make a big difference. Here's the bottom line. Amyloidosis is rare and complex, but it's not impossible to manage. Nurses really are the thread that holds this multi-system puzzle together. With sharp assessment skills and compassionate care, we can help patients live fuller lives, even with such a challenging diagnosis. So, have you cared for a patient with amyloidosis? Please share your organ-specific care tips in the comments. And don't forget to like, subscribe, and follow for more deep dives into rare diseases, because honestly, complexity is where nurses shine. And remember, recognize, support, advocate,